Okay. We're having a rally for people who having a rally for people who have lost their health care due to Trump's big beautiful bill.
You need help, sir? No, you're good? I got a railing. I'm good.
He looks fragile. He is.
I'll probably need more help than you do. Especially, I have a hip problem. Are you good now?
No, I have to remember. I used to be down with the bed, up with the good, until I fractured my opposite leg.
Okay.
Now I gotta rechange my mind.
So you make do?
Yes, I make do. All right.
Okay.
Testing.
You know they got the elevator here, but you
So we're gonna sit on the steps. We're gonna get ready to start the program. Anyone down there, if you can make your way up to the stairs, please do so.
trouble walking up the steps.
Eddie.
What do you have? Your lounge chair? Jesus.
Yes, I do.
Right. Thank God you brought it. Thank you God you brought it for me.
No, this is my wife.
I'm only kidding. Take your time. Oh, you should have used the handrail. That's what I used. Yeah, apparently they said it. I didn't even know we had to.
All right, so let's get started. If you're making your way up the stairs, you're going to put it on the landing pole. Take it up the stairs.
Hey, how are you? How you doing, Dave? I'm doing all right. How you doing? Good. Welcome, guys.
So without further ado, I first want to say who I am.
Can I sit there anyway?
And we're making it up the stairs, hey David.
So I don't fall over.
So my name is Teresa Sullivan. I work for Philadelphia Fight. Right here. Yeah, I know, it doesn't take much, right? So we're here today.
Thank you, sweetie.
Because of health care is under attack. We're here today because we know that health care is a human right. We're here today to fight for that health care for everyone in every population. No one left behind. This administration is trying to do something that's horrible. And we said, hell no, we won't go. We want health care.
Hell no! We won't go! Hell no! We won't go!
Okay, you hold on to it for me. So without further ado, I want to introduce Jen Waxman, our representative from Pennsylvania. So put your hands together, give a nice welcome.
Yeah.
I'm State Representative Ben Waxman. It's my honor to represent the 182nd District, which includes the historic neighborhood and here in St. Luke's. And we're just so grateful to our partners here at St. Luke's who host so many important gatherings here at their church. I want to welcome everybody who is here tonight, and I also want to also say hello to many of you who have been to my office in Harrisburg to advocate for issues like what brings us out here tonight. So we are in a moment where we seem to have lost our moral clarity. And we are in a moment where we are paying for tax cuts for the wealthiest people in our society with cuts to health care for goddamn near everyone.
Shame! 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 Shame!
We know what the impact is going to be for the thousands upon thousands of people who are at risk for losing their care, either being kicked off or having to deal with onerous requirements like a work requirement that can sometimes lead people not to being able to get the care and the coverage that they need. So we know that that is something that is imminent.
Yeah.
But we also know that this is not the first time that people have come under attack. And it is not the first time that people have stood up and said no.
Yeah.
And that is what we are doing here tonight together. And we are here to say that we are going to stand against these cuts and we're going to protect all people in Pennsylvania. So thank you for being here, and with that, I'm going to turn the mic back over. There we go.
Thank you so much. So our next speaker really doesn't need an introduction, but I'm giving you one anyway. So Evelyn Torres.
Yay!
Active Wellness. Yes. She's a friend to our community.
Yes, thank you, Teresa. Thank you for those kind words. Hey everybody, how we all doing tonight? Change is coming, right? Change is coming. Good evening, and thank you for being here. I'm very honored to be here and speak tonight among all these illustrious speakers today. I just want to say very quickly, para los que hablan español, tenemos la información en español. Y si no hablan inglés, tenemos la información escrita en español. ¿Ok? Mi gente. So my name is Evelyn Torres, and I'm the executive director of Action. Action Wanted has provided life-saving.
I'm gonna move up here so I can get a better view.
Their 40th anniversary. Is based on their ability to have access to health care, food, and to housing. That's right. And so today we gather not only to honor those we have lost, but also to stand in solidarity with those whose health and well-being are threatened by the changes to Medicaid and SNAP. These programs are lifelines for millions of Americans, including thousands of Philadelphians. Changes to Medicaid are projected to reduce funding by roughly $900 billion to $1 trillion over 10 years. And for what? To fund the richest individuals. In Pennsylvania, you talk, you tell us. In Pennsylvania, funding will be reduced by about $20 billion over 10 years. State estimates indicate that more than 300,000 Pennsylvanians receive Medicaid coverage and work requirements and other eligibility changes take effect. In Philadelphia, anywhere from 60 to 80,000 use their Medicaid insurance. 65% of our clients at Action Wanted rely on Medicaid for their health care. Nearly 1/3 of our neighbors depend on SNAP. Even the signs are upset. They know the truth. Proposed federal funding cuts mean fewer doctor visits, delayed treatments, increased illness and death, increased hunger and greater hardship for families, seniors, children, and people with disabilities. These are not just numbers we're talking about. These are our neighbors, our family members, and communities. This is us.
have lost 10 accidents, which really eliminate HIV. Baby care.
Unfortunately, unlike Evelyn, my eyes won't allow me to read small print. Big print. Speech I'd like to start my remarks about the rapidly growing healthcare crisis now facing the LGBT community with a short look at when the basic concept of LGBT healthcare first showed up in Philadelphia. Almost 50 years ago, I was part of a small group of gay men who came together to plan how to address the major health challenge we thought were facing gay men in Philadelphia at the time: the epidemic of hepatitis B infection. Our plan was to start an LGBTQ health clinic supported by funds from the pharmaceutical companies who were about to release an effective vaccine for hepatitis B. Initially we failed, but we refused to be discouraged. After all, we were still in the time when the eyes of mainstream America, the disease that really needs a cure was homosexuality itself, not some obscure infection we would have heard of. By the way, that small health clinic we envisioned eventually became what is now known as the Mazzoni Center. Right. Mazzoni was one of the first health clinics established in the United States specifically for LGBTQ communities. Soon we found many allies and teachers from the women's health movement. The AIDS epidemic finally convinced the government agencies that have ignored us for so long to begin to step up. Since that time, using public funding to help LGBTQ communities keep healthy has become less controversial, especially as it relates to AIDS. Mark this moment, those days are over.
Yeah!
I share this history partly because as I get older, I find I worry our advocacy history is being forgotten. But also to remind us that it really is possible if we're patient, smart, and persistent to change the way things are. Unfathomably, we are here tonight because new political reality has brought into question whether government should even be involved in supporting quality health care for all American citizens. So much of what we spent decades trying to create and secure is now being threatened by federal. In Pennsylvania, the Trump administration has forced a 25% cut in federal AIDS funding. And in a particularly cruel aspect, made the cut retroactive to last July. It's reduced eligibility and made it harder for people with HIV disease to qualify for pharmaceutical benefits. And they've taken an axe to funding for housing assistance, medication access, and other support services for people with HIV disease. Eligibility for HIV drug assistance under the Special Pharmaceutical Benefits Program has dropped from 500% of the poverty level to 350%, abruptly cutting off thousands of people who this moment are relying on that program today. Without state support, many people with HIV will now have to find a way to pay out of pocket for treatment regimens that can cost between $2,000 and $4,000 every month.
Shame. How are they gonna do it? Who can do that?
few communities will be upwards of $2 billion in Pennsylvania alone. This means no more CDC HIV prevention programs, no more HIV testing programs, no more support for housing assistance that is currently supporting 100,000 households impacted by HIV in the United States. The budget plan includes a whopping 78% reduction in the CDC HIV prevention vaccine. Epidemiology models from Harvard project that this cutting of HIV prevention efforts will cause new infections to spike by almost 10% overnight. While Philadelphia and Pennsylvania public budgets have to be approved in only a few weeks, and there's little hope that very many of these draconian cuts can be restored. Federal budget is still being debated in Washington and will continue to be for several more months. That can mean months for Washington to come up with even more evil ways to help people with HIV survive, or months for us to mobilize to fight back. Advocates from my generation had to fight many, many battles over the last 50 years to remind America that we were intended to be a nation that would stand above all others in a way that valued its citizens. I long ago realized those battles were never over, but we have much to be proud of for the progress we've made. Despite the many sad and evil moments that marred American history over the last 250 years, the fact that we have nonetheless made progress shows that we are fully capable of creating a just society that supports even its most vulnerable citizens. 50 years ago, a small group of young gays came together, gay men mostly, came together in Philadelphia to demand that LGBTQ citizens be treated as equal citizens when it came to politics. We didn't succeed overnight. We collaborated. We did ultimately win. But much of what we fought for is now at risk of being. We cannot forget all the people who have lived only because of our own community. That is, people like those of us on this vigil tonight came to their aid and never gave up. It's time to come to their aid again. We cannot fail them. We just cannot fail them. Thank you.
There are over 11,000 of us across the state of Pennsylvania. We years ago, healthcare workers confronted a new and terrifying disease with very little information, very little resources, and widespread fear. I recall that because I was at the bedside 42 years ago when we learned about AIDS. Yet, what did we do with the lack of resources, with that fear? What did we do? We showed up. Why? Because we care. We fought for stigma, humanity, and collectively, the community activists demanded research, treatment, and dignity. Today, we honor that legacy. And I will say, as a side note, to Pasnat is 26 years old. And what happened to Pasnat 26 years old? We decided we needed to have our own group of people that recognize that we are in a mission, and it is a healing mission, and we are patient advocates. And that's why we are a union, but we have a mission, and it's patient advocacy. As healthcare workers, we know that disease does not discriminate based on our party, ideology, income, race, gender, or who someone loves, and that healthcare should not be political. Our responsibility is to care for the patient, and our government's responsibility is to ensure that healthcare is accessible, evidence-based, and grounded in public health, not in politics. Legislation that created devastating cuts to Medicaid and failed to extend the Enhanced Affordable Care Act, which will result in 51,000 preventable deaths annually. That is what that is. 51,000 preventable deaths. So this is not a result of unavoidable, that contract is unavoidable. It's not clever of we can take care of this. This 51,000 is a policy choice. The lesson that AIDS isn't just that medicine advances, it's that progress requires courage, which everybody here has the courage to be here, advocacy, which is what we're doing, and funding, and a commitment to basic health and dignity. Right now, nurses are negotiating, and they're asking for basic safety measures for patients, and to maintain critical services that they put away, which is the pediatric services. This is they're vital. This is just one example of the vital services to our communities. Just what's going to happen with the vital services that we need here to support our AIDS patients. Einstein is a $15 billion corporate giant that has spent money on gaining rights to the AIDS practice facility, and also spending money on the TV ads for other hospitals. Of note, the CEO received over $5.5 million in compensation per year. Right. Shame. If that kind of money could be spent on non-humanitarian products, it is clear where the harm is, where we see harm. At PASNAP, we believe that healthcare is a human right, not a business transaction. That's why we have created the Healthcare Bill of Rights.
speaker is Natasha Weaver. She is representative of my office as a political advisor.
All right.
Good evening. My name is Natasha Weaver, and I'm council member of Lawrence This is a powerful moment, and before I begin, I want to take a second to acknowledge those that have lost their lives and those that might be in danger due to reduced access to health care. Councilmember Ahmad is the chair of Public Health and Human Services, and she is also one of the 7 at-large council members. We are in the midst of a crisis. Last year, Congress passed Donald Trump's One Big Beautiful Act, an effort to cut services to our most vulnerable masquerading as cost savings. This act included more than $1.1 trillion in cuts to Medicaid and SNAP. And in Philadelphia, 34% of residents, including 68% of children, rely on Medicaid for healthcare coverage. In 2023, nearly 30% of Philadelphians received SNAP benefits to help put food on the table. In Pennsylvania alone, we can see over 300,000 residents losing access to Medicaid. And that isn't even to speak on our most vulnerable and how these cuts impact them. More than 2 out of 5 mothers who gave birth in 2021 had Medicaid as the principal source of payment for the delivery, and women make up about 36% of people covered by Medicaid, including more than 16 million who are at reproductive age. And let's look at how this impacts mental health and the intersections of race and poverty. A 2022 report published by DBA found only 1 in 3 Black Americans in need of mental health care compared to 1 in 2 white Americans. Even more alarmingly, a study published in 2020 found that the suicide rate among Black youth rose by 73% between 1991 and 2017. These are unacceptable numbers, and they signify that something is very wrong with our culture. Medicaid is the nation's single largest payer for mental health services and provides coverage to nearly 40% of all children in the United States. Young people who have experienced it in the foster care system are up to 62% more likely to experience mental health challenges than young people overall. So when we cut Medicaid, we are cutting services to people who need the resources the most. Cuts are also coming to food access too. According to a study from Feeding America, the childhood food insecurity rate in Philadelphia hit 30.5% in 2023, up from roughly 24% in 2019. That means that approximately 103,000 young people are affected by hunger in Philadelphia. And the Department of Public Health issued a study that found 63% of Philadelphians live in areas with an overabundance of unhealthy food, and 16% of Philadelphians living in those areas are also living in high poverty environments. With Philadelphians facing increasing barriers to nutritious food, federal funding cuts to food aid programs and a seemingly never-ending rising cost of living are a real danger to many people. But there is light. Councilmember Ahmad is championing programs that aim to fill some of these gaps. In 2025, she secured $500,000, which is the first-time investment in the Blue Bus program, a program that provides SNAP users with incentives to buy fresh produce at food markets. She also passed a bill that provides reasonable accommodations and protections from discrimination for those experiencing menstruation, perimenopause, and menopause. And that's just the beginning. That bill takes effect January 1st next year. So I want to say again that I am here on behalf of Councilmember at Large, Dr. Gina Ahmad, and that we stand in solidarity with all of you today. Our hearts are with those who we have lost, and I pray that we don't have to lose any more precious lives. Thank you for this invitation, and have a blessed day.
Our next speaker is Raheem Douglas from the Union 173.
Okay, Raheem. All right, Union, we love Union.
No problem. So my name is Raheem Douglas. I'm the Vice President of Unite Here Local 274 right here in Philly. I'm also accompanied today by President Nicole Hunt from 634. Right there. The President of my local, Rosalind Wisnick, Local 274. So this is real simple for us. Healthcare is a human right. We have workers workers who fought over healthcare and have won. And I would like to actually highlight some of those stories. We know they want to take everything from us, including slashing and gutting healthcare, right? But we've been fighting. So thankful for stadium workers, right? Y'all might have heard about those stadium workers that went on strike during the playoffs and various other events. Fred Motley is a worker who should have been here speaking today, but unfortunately he wasn't able to participate today because Fred has had some health issues. I am also happy to report by Fred striking, Fred now has health care. And my brother, he's home, he just had his operation and he is healing and he wasn't able to join us today. So, happy about that. Healthcare is what?
Human right. Healthcare is human right.
Let's talk about independent Blue Cross Shield.
Whoa.
So, there is a group of workers down there, right? That work down there at that building, cafeteria workers. And you gotta remember, think about this for a minute. Blue Cross is at the heart of the industry, right?
Yeah.
And cater and cafeteria workers right now, they serve corporate. And for a long time, they did not have health care down at that building.
Oh my God.
So I'm happy to report, as of May Day, they got a contract. We will have health care at Independent Blue Cross Blue Shield because those workers fought. Yeah. Let's talk a little bit about the airports real quick. There's a place called Sky Chefs. They cater to airlines there, along with SSP, concessions at the airport. Those workers for a long time at Sky Chefs, they weren't considered airport workers, even though they catered the airlines. So that took a lot of fighting over the years, and I'm now also happy to report SSP and Sky Chef now have good union health care. The unions have always been at the center of these fights, right? For health care. Yes, sir. Because again, health care is what? Let me talk about a group of workers at the Hampton Inn real quick. There's a group of workers at the Hampton Inn that went over 2 decades right down there. They didn't have health care for about 2 decades. And because they went on strike, guess what? They got their health care back, right? Right? Oh, we've been fighting, but this fight ain't over. It's nowhere near over, right? We got Local 634 right now, right? Members, and these are the workers that work in the school district right now. Because of the budget, they can lose their health care. So we must continue to fight.
We can't let that.
Hotel workers right now planning to go on strike during the World Cup. We have hotel workers going on strike if you have not heard. And just think about this, because of Trump's big, beautiful bill, right? Costs will rise. It's going to be harder putting children on CHIP, things like CHIP. It's forcing us to now fight harder for family plans, family health care, right? We used to be able to get do what we gotta do with single coverage, but now, because of that bill, we must fight for that coverage. But we're ready to strike. Yeah. We are ready to strike. Will y'all stand with us? Yeah. We're ready to strike. We're a union town. We believe unions for all. Yeah. Health care for all. Unions for all. Unions for all. Health care for all.
This is the top of to united as one in community and fight. Right? Not in silence, but together. We have to do this. And I am so grateful for David Fair, not standing on that giant shoulder. Right, as an activist, that what we had in the beginning of the epidemic in the 80s and the middle of it, we stood together and we fought and we refused to lay down and die. Right. Unfortunately, so much damage many of us didn't, and we stood up and we fought. Our fight is not over until it's over. Right? So with that being said, I wanted to introduce the legend. The legend. Why is the
My name is Juanita Bender, and I am a local, national, international human rights and social justice activist. But I'm here today to speak on behalf of my community, and that community is people living with HIV. I want to raise awareness that today, June 5th, is National Long-Term Survivors Day for people with HIV and AIDS. Today is the anniversary of the first official reporting of what became known as the AIDS epidemic 45 years ago, June 5th, 1981. I'm here to remind Congress, state and local governments that without medical coverage, people with HIV, people like me, people like some of you here, cannot afford these medications. My current medications can run up to $70,000 a year without health care. 1.5 million people are living with HIV here in the United States, and 65% of those people depend on Medicaid to get these covered life-saving, sustaining medications. Treating HIV has to be a human rights directive, and it has to be a health care priority. Missing doses can cause the virus to replicate. Missing doses can cause the virus opportunity to mutate again, and it can render previous medication mutated and infected. Any interruption in treatment could be devastating and irreversible. Even as we stand on the precipice of the end of the HIV epidemic, HIV can become the devastating community health concern all over again. And that is why we keep fighting. And that is why we stand up. And that is why we show up. And that is why we speak up. And that is why we act up. The people with AIDS are under attack. What do we do? People with AIDS are under attack. What do we do? The Medicaid is under attack. What do we do? The Medicaid is under attack. What do we do? When our union workers are under attack, what do we do? Union workers are under attack. What do we do? When our healthcare workers are under attack, what do we do? When poor people are under attack, what do we do? When LGBT communities are under attack, what do we do? Healthcare is under attack, what do we do? We act up, we stand up, we show up, we speak up, we fight back. And the last thing I want to let the folks in City Hall hear us now. I want to let the folks in Harrisburg hear us. I want to let the folks, make sure the folks in the United States Congress hear us. When we say healthcare is the right. 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 And as long as we keep showing up and standing up and speaking up and acting up, we cannot be ignored. Silence equals permission. Our silence equals permission. We're not going to give the federal government permission to disappear us. And that's why we're here today. And I figure that's all I have to say. I believe we have before we light all the candles, I think we're going to call Mildred Lewis up, who's going to sing a song for us.
Thank you, Juanita. Do you want to spread that back up here and want to take the morning one? I got it. Yes, you got it. Like you say. Here you go. Don't make me cry. Don't make me cry.
I think this is right. How y'all doing? I wouldn't be able to sing this song unless I'm trying to go from the top of my head why it's so important to do this song. This song is written by Sam Cooke. It's called
disrespected, discriminated, because someone has been and went to a hotel. They went to a Holiday Inn at a hotel, and they had already booked this hotel. But when they got there, people realized they were black. They wouldn't let them come in. But they stood their ground, and so they wouldn't leave the lot. And because they wouldn't leave, they called it disturbing the peace. And every last one of them got locked up, including himself. And so he went home, and he wrote this song. It's called "A Change is Born and Come." Okay, so that's what I'm going to leave it. You got to connect it to the YouTube. You got to connect it to the YouTube. Yeah, where's he at? We're, Ted. Oh, wait a minute. Oh, wait a minute. It's the blue. What's the name of this Bluetooth? It's the Bluetooth. Oh, he's there.
What's the name of it? Is it Samsung?
Is that a Samsung Bluetooth?
BT speaker. No, that's my own speaker downstairs. What's the name of it?
Jackson.
What did you say? That's not you over here telling me that.
Can you call? What you call real quick? The
Got it.
Yeah,
Got it.
Woo! Take care.
Okay, here you go. Wow.
that we're going to, and they're turning us down. They're knocking us down on our knees, but we don't give up. Because the change is going to come. Yeah. So just remember that. Thank y'all so much.
I was very honored to that front. That's somebody, Jack.
So, before we get to the middle and ritual and call those names and those who are not gone but not forgotten, I want to give the opportunity to the Nurse Association.
Yes.
Thank you so much. I just want to offer everyone the opportunity, maybe when we're done, after the reading of the name, to sign our healthcare Bill of Rights. We did this in part because of the 250th anniversary coming up. We have a Bill of Rights for the country, and we think it's time to have a healthcare Bill of Rights. And we have I have some markers here. We can sign it. We're gonna have it in person, and then we also we pass around these for those of you who have phones. If you take a photo of that little square right there, you can sign it online. We're gathering these. We're looking for organizations and also individuals to sign, and then we're gonna gather them, and we're gonna pass those on to our elected officials and ask for their support, and keep that in mind leading up to November when we're going to the ballot box to vote. And also our local healthcare companies, our Blue Crosses and our Jeffersons, and all of those folks. So thanks for organizing this, and we're happy to be part of it. And I will put my passing on right now. Thank you so much.
Thank you. Stop signing, okay? All right. So we have come to this event, all right? But we have not come to the end of this fight for housing. Right? I want to personally thank each and every last speaker that spoke today. I want to thank Mildred for making it quiet always. Taking such a small heart. And I also want to thank each and every last one of you for showing up, showing out, and caring for something we all need to survive. That's called what? Healthcare. So without further ado, we cannot end this ritual and this event without recognizing those who support, lost their lives, and are no longer with us. So if you got a candle, you would give the candle. I want y'all to take one moment of silence first, and then I want you to hold your candle up and say,